versus it being something more serious, something neurological?
The symptoms of ADHD are things like some you mentioned: fidgeting, talking excessively, really being disorganized or disruptive, impatient, interrupting, distracted, also being forgetful or unable to pay attention to detail. So I'm looking and people are like, yeah, that's all kids, right? Well, yes, true. All children may exhibit these behaviors at one point or another, but children with ADHD are a little bit different. They have these behaviors over time, usually 6 months or more before the age of 12, and these behaviors are excessive for their age.
How does this show up in the educational process? Because I know her daughter has had an impact and they want her to repeat a grade because of her inattentiveness.
It's not unusual for kids with ADHD to have trouble in school, and it can show up as learning disabilities, disruptive behaviors, mood disorders like anxiety and depression. All of these affect what's happening in school.
So what are some things that parents can do to help manage their kids' ADHD symptoms?
First step, visit to the pediatrician. Your pediatrician may be involved in checking for things like seizure disorders, sleep disorders, things like thyroid problems. These can actually resemble ADHD, so you want to make sure that you know what's going on there. And then you want to make sure that they are properly diagnosed with ADHD. Then a long-term treatment plan gets put in place. There may be a whole range of things that we can do to manage ADHD. It may be behavioral therapy, counseling may be recommended, educational interventions may be needed, and medication might be recommended as well. So ask all the questions that you can possibly ask, get comfortable with the recommendations, put the treatment plan in place. Then you want to really follow it carefully and make sure that if there are any changes in behavior, symptoms, new symptoms, you're in constant touch with your healthcare team.
And Hillary, I'm saying this to you and all the parents out there that are in this situation. The first thing you got to do is educate yourself.
So, there's so many misconceptions around this disorder, and one of them is that children somehow outgrew ADHD when they became adults. No, not so much. And so what we now know is about 40 to 60% of children with ADHD grow into adults with symptoms of ADHD. So that long-term treatment plan that you and I keep mentioning to you is really important because you want one that's flexible and can be adjusted to the new environment.
It's critical that you get the right diagnosis.
For tips on the everyday management of ADHD, as well as links to parenting resources, you can visit gethealthystayhealthy.com. You can also sign up for our monthly newsletter for health information sent directly to your inbox.
Thanks for being here again.
Thank you.
And thanks for sharing this story. I really appreciate it. I want to thank all of my guests today, especially Dr. Frida Lewis Hall and Origins Behavioral Healthcare. For more information on today's show, you can visit drphil.com. We'll see you next time. Hillary, thanks so much.